You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with small diameter or mini dental implants. With us, we have an expert on the topic, and he says nobody should be wearing a loose fitting denture. With us, we have Dr. David Tambor. Dr. Tambor, welcome to the program.
How are you? My pleasure.
Now, before we get into today's topic, for people that don't know your practice, because you do a lot, I guess you focus on these mini dental implants, but who's the typical patient that comes in for mini dental implants?
I don't know that I have a typical patient. We have patients that come in as young as 19 and up to about 94 as the age range, and they can be people that are missing all of their teeth and are denture wearers, or they can be people that are just missing one or two teeth, or their teeth are on the way out. And there's just so many. Almost all my patients at some point or another seem like they could use mini dental implants and the teeth that go with them. Yeah, some of the people just are sick and tired of dentures. They don't want to have to wear them anymore. They can't stand them, and when they learn that there's something else, they want to have something else. And then there's other people that they're on their way to it, and they're just desperate. They just want to have something that's going to work for them, that is going to allow them to smile again or allow them to eat again.
Okay, now you've been doing this a long time, right? You've been in and around dental implants for how long now?
The first one's probably 30 years ago.
30 years.
30 years ago, yeah.
Now, this is not a recognized specialty implant, but this is your focus. this is pretty much all you do. Is that right?
Absolutely. It is not a recognized specialty, and it is my focus. And I placed my first mini implant in 1999. So it's been a while. It's been a while. This was when it was really, nobody knew about it. I took a course at NYU and we started doing it. And we're still actually doing, because it was so successful, we're still doing that particular procedure as one of our procedures. It just got much better. There was amazing research done that showed eventually that mini dental implants or narrow diameter implants have almost the same or the same success rates as conventional implants, but so much easier for the patient.
You say they're about half the cost, half the downtime.
Yeah.
Like it's less of a surgical procedure.
Is that true? Much less. Okay. Much less invasive. It's less painful.
And it works? You could get a brand new set of teeth, upper and lower, that don't come out, supported by these mini implants.
A brand new set of teeth that don't come out, that are yours, that you can eat anything. You can bite into an apple. You could bite a corn on the cob. You could bite. I had a patient in the other day who we took care of her about 10 months ago. And she's just, the fact that she can now eat raw carrots again. She likes her raw vegetables, raw broccoli. Some people do.
So they can bite a carrot?
Yeah,
even with their
bite a carrot.
Tooth?
Can bite a carrot.
Is that right?
Yeah.
So you hear eating stories all the time?
A lot of eating stories. And also stories about just how, I had a patient who was a vegan chef in town. Really nice guy. I didn't know what his teeth looked like, because he had this big bushy beard and mustache and didn't smile much. And we took care of him. We gave him his teeth back. And he is now all over Facebook. He's all over Facebook. He's just with this grin. And all of a sudden, and he's doing courses, he's doing cooking demonstrations. In fact, he invited me to come down to it.
Okay.
And everybody there was thanking me for helping this guy out. And he cried when we put his teeth in.
Wow, when you show them the mirror?
Yeah.
They break down?
Oh my God, that happens a lot. Not sometimes, it happens a lot. You really are giving people back their life. I've been doing this for a while, and it still takes me by surprise. It still can be breathtaking sometimes at people's response.
So do you think that's the future of dentistry? Like, whether it's 20 years or 100 years, dentures as we know them today, just floating in the mouth, will be gone. They'll all be attached to something?
It's not the future, it's now.
Okay.
We're doing it today. I do it every day in practice, I don't think we have to wait till the future for it. It's available to anybody in any practice. All you have to, the dentist just has to get trained up in it, and the patients can have this.
Now, so in Arizona where you are there a lot of denture wearers, or a lot of people like headed to dentures or about to have dentures?
Do you know the McHale Center in Tucson? It's the
Yes.
University of Arizona's field house for basketball. Great place, by the way, to go watch basketball games. Amazing. About 14,500 people in. We could fill that place 10 to 15 times with the people that need to replace teeth, not just dentures. I mean, just missing 1 tooth, 6 teeth, all their teeth, or they're heading that way. Yeah,
So it's a big problem.
A lot. You walk around town. I come from the East Coast originally.
Okay.
And I've been in Tucson for a while now. To this day, I'm shocked at how many people are walking around without teeth. I mean, a lot of missing teeth. It's just...
Well, then if mini implants are so good, why aren't they all doing it? And let's talk about the denture wearers. Since they're in the worst position, why don't they come in to just get them locked in?
I can tell you what my idea is around this.
Okay.
I think, first of all, as far as denture wearers, if they've had dentures for a while, they're not going to the dentist.
Okay.
Maybe they'll go in if they got a rub spot, maybe they need a reline, but they may not see a dentist for 7, 8 years or more. And the issue is that they're just not informed. They don't know about it. They don't know what the options are.
Makes sense.
And honestly, people come into me having seen something that I talked about on TV before, and they asked their dentist about it, and their dentist didn't know about it. So it's the information.
It's fairly a new thing.
It's a fairly new. It's a new thing, but
there's been a select few dentists that have been doing it for many years.
Exactly. So, but they're not really being informed, So that's one of the reasons. The second thing is that if you've had a denture, you're wearing a denture, you've been through a lot dentally. You probably have had toothaches. You've probably had root canals and crowns. You've probably spent a fortune. You've probably gone back and forth to the dentist so many times. Frankly, a lot of the time, denture wearers really are just relieved to not have to
get all their teeth taken
out. And so that's a really significant player in this. Another issue is they're afraid of pain. They don't really know that we don't have to put in 24 or 28 implants. And the truth is, we can give them all their teeth back, and it's much less costly than that. So they have a misperception about what the actual expense is for them. In fact, it's gotten to a point where, if I think back to when I was having implant cases 10, 15, 20 years ago, it's less expensive today than it was back then. How many things in the economy are actually less expensive than they were 15 years ago? So it's really an extraordinary thing to be able to help people out in ways. In the past, they couldn't afford it, thought they couldn't afford it, and we have financing to help people. So
because we have to mention insurance, Medicare, Medicaid, it does not cover dental implants or mini implants. Even the best dental insurance only covers a very small portion.
Yeah,
Some people finance this.
They do.
It's common to finance it?
Very common. Very common.
So like most people do, get some financing.
I would say at least half the people actually finance. And
you're not carrying the loan, right? So it's like a lender that if you have OK credit,
we have companies that we work with. Yeah, if you have OK credit. But I know patients, once they see that this is a possibility, they get help. They figure out a way.
It's a skeptical crowd, these denture wearers, or these people that have really bad teeth, bad gums. Because you were saying, we were talking in the green room, that they've been watching you on TV talking about this for more than a year. They've watched your interviews over and over, and they're still skeptical when they walk in the door.
It's true.
Is that right? What do they say?
It's so true. First of all, they do. They say, they'll come in and they say, I've watched you 12 times. I said, 12 times? What took you so long? And I think sometimes it feels too good to be true for them. And part of that is that they have friends or family and/or other dentists who are telling them it's too good to be true. This is why it's so important to educate people, to let them know that it's there and that it's doable. And we really, with the scanning that we have today, with CAT scans, we can tell that visit right then and there.
Was that right?
If they're a good candidate, we can see if they've got good bone. And I would say probably 90 to 95% of the time, we can help people.
So if everything works out, somebody watching this, let's say they have no teeth. If everything works out, in just 2 visits, they could probably get a brand new set of teeth?
Yes.
Is that right?
Yeah. Hard to believe.
Does that happen every once in a while?
Yeah, it does. It's even saying it's hard to believe, but yeah, that does happen. And I know it happens because I've done it over and over and over again. It's pretty trippy. Actually, if they're missing 1 tooth, I can sometimes do it in 1 visit.
Okay.
We can place the implant, and I have a machine in the office that we can make a cap or a crown. We can actually do it that day, put the implant in, put the crown on that day, and it's a single visit, and they can walk out with a tooth.
Now, at your office, I guess how it's normally done with dental implants, you go to one doctor that does the surgery, another dentist that'll put the teeth on top, and somewhere else for the imaging, and you do it all right there.
That's
so
right.
aside from convenience, what's the big benefit to the patient?
Convenience is a huge benefit for patients. My patients, I'm big on convenience because people care about that. People care about their time. They care about how many number of visits they have to come in. Also, it's much less invasive. We like to save teeth. We also like to save bone. And with mini implants, we can do both of those things. Patients like to save teeth and they like to save bone. It also costs less. And because it costs so much less, I pass that on to the patients.
Now because you do a lot of advertising, are there people that come in and say, look, I need all my teeth out and I want what you're talking about on TV. I want a brand new set of teeth. Do you ever save some teeth from there?
Yes.
So a lot of people already think there's nothing that can be done.
Yes. Yeah. In fact, that happens a lot. That happens a lot because I'd rather, I still believe that if the patient comes in and their teeth are in good condition, if the bone looks good, that I still believe that that's the healthiest, best thing to have in their mouth.
Okay.
Very often we'll augment by adding a few mini implants, and we'll maybe cap some other teeth or do some.
So it's a less expensive option.
It's a less expensive option. It's easier for the patient. Patients are thrilled to hear that.
Is that right?
Oh God, if they can hold on to teeth, if they don't have to have all their teeth, and they come in often feeling that way. I'm going to have all my teeth out, and I look at them, I think. I think we can save most of these. I think they would still look absolutely, And there's cases where we can't, where it's just they're a mess. They're shaking.
But isn't it true if you have really bad gums, you can't do this? You can't get implants?
No, absolutely not. In fact,
I mean, even with gum disease?
No. What you want to do is you want to get control of the gum disease, which very often, if the teeth are in bad shape and you remove them and you clean everything out, you get rid of the gum disease.
So the gums get healthy.
The gums get healthy. In fact, that's a very important part. We don't want to just be putting implants in people and not having a healthy situation. Our goal is to have somebody be beautiful, handsome, and have a really healthy bite, healthy teeth, that they can just eat whatever they want, and for it to stay healthy. So honestly, I think people get a lot healthier when you take these bad teeth out, teeth that have had root canals, that have chronic infections. When we take them out and you put the implants in, the bone and the gums love it. They heal up really well. Yeah, they love it. I mean, it's a really amazing. The gums love titanium. They just do. Now,
look, I have dentists, and I don't want to go negative here, but I have dentists that come on the show and say the problem with these mini implants is they're just too small to work. I mean, they're cheaper or less expensive, but they just don't work. This is what they tell me. Yeah. So what do you say to that?
First of all, I would say the research says something different.
Okay.
There's been studies now, long-term, 12 years longer, that show that mini dental implants have the same success rates or very close to conventional implants. And actually, I've been doing both of them for a lot of years, conventional implants even longer. I can tell you the thing that fails most often, and any implant doc will tell you, is the little tiny screw that's inside that connects the crown to the implant. Okay. We don't have that on mini implants because it's one piece. And our mini implant is almost 2 to 2.5 to 3 times thicker than that little tiny screw that fails. So mini implants are actually stronger. You
believe that?
I do believe that. And I believe it because I've seen from years of experience. I've seen whenever implant crowns fail, it seems like that little screw breaks or comes loose or strips. And mini implants they're much heavier, they're much stronger than that. So a lot of times conventional dentists, I think part of it is they're just not trained up in this.
So in addition to being able to eat and chew and smile and all that, but the main thing is, like you said, that in dentistry, here you get like a brand new set of teeth, but most people couldn't afford it. Mm-hmm. Now there's an affordable way.
Yeah, absolutely. And there's the permanent set of teeth, which are the Mercedes. That's just getting getting them back just like they were before.
Then let's talk about that. So a patient comes to you. Okay, 2 types of people you talked about. The one group with the really bad teeth, can't save them. They need extractions and a denture or a new set of teeth with mini implants. And then the current person watching this, they have a denture. So they go into your office. If everything's good, what are their options? Take me through that.
One of my favorite that's among my favorite patients, actually, the ones who come in who have a denture already. Particularly, give me. If I have an elderly patient come in their 80s who has an existing set of dentures, we can literally put in mini implants and retrofit those dentures if the dentures are adequate in one visit.
So you can use their current denture.
We can use their current denture. Talk about a cost savings for the patient. We can place the implants and retrofit using their existing denture, and they walk out with teeth that snap in that are solid.
No more adhesive?
No more adhesive. And I could tell you, it's a shock to them because they've been using adhesive literally for decades, and it's right away. It's amazing. It's an amazing procedure.
I know a couple denture wearers. They never complain. I mean, are you saying there's really no such thing as a happy denture wearer?
You're not a dentist. Why are they going to complain to you? They're not going to complain to you. Any denture wearers who come to me complain to me. They all wear adhesive all the time, and they hate it. I mean, maybe you'll have an occasional person out there who has a full upper denture that they don't need adhesive. But in general, they're wearing the adhesive. It's a billion-dollar industry for a reason. They're wearing adhesives. They hate them. They're embarrassed by their teeth. I had a guy the other day was playing golf. Actually, he does not anymore because now I fix his teeth. But a month ago, he was telling me he was playing golf and he sneezed and his denture fell out on the golf course.
Wow.
Yeah, he was very, very unhappy.
His buddies must have laughed.
Yeah, he was not a happy guy about it. He said, "This cannot happen to me ever, ever again." And another guy was telling me he was out on a date and his teeth came loose while he was at dinner, and he's afraid to go out on dates. He's afraid to go out on dates. The guy who was the golfer, we placed mini implants and we actually made snap-on dentures for him, and they're solid. They're solid. I will tell you, interestingly also, oftentimes these patients will start with that and then they'll upgrade to the fixed permanent teeth.
That don't come out.
That don't come out, just because they're so happy with the implants and they're not sure. So it's sort of a nice transition, and I don't charge them twice again for it. So one of the really nice things about mini implants is they're sort of transitional too. You can upgrade them.
So you could start with a snap-in,
you can start with snap-in,
and go to a set of teeth that don't come out.
And just add a few more implants, and you can go to the permanent teeth.
It seems like that's what everybody wants, right? Teeth that don't come out.
Oh, everybody wants it. Everybody wants it.
What about the upper? The upper is good because the palates keeps it.
You obviously don't have dentures in your mouth.
Okay.
Because if you have a palate, they have a plastic, you gag. You don't taste your food as well. When we do, like I talked about, a patient where we retrofit their denture, we'll cut the palate out of that denture and we put it back in, and it holds in tight, and they suddenly can taste their food, and they come back and they tell me, I can't believe it. I just forgot how good eating could be. It's kind of cool. It's very cool.
Are husbands and wives doing this? Like one will get it done and then there are a couple of denture wearers and then the other one comes in?
They do, but it's really interesting with husbands and wives because very often it's a secret. They're not really, a lot of times, this is another problem with being a denture wearer, a lot of times they don't even know, particularly the wives. They
don't tell?
They don't tell their spouse,
that they're wearing a denture?
No, and they'll figure out ways to take them out to clean them when there are others out of the house, or they will never let them see them with it. And so, some cases they come in, they want to do things together, and sometimes they don't even know about it. And they'll say, I'll have a wife come in and say, "Don't tell my husband." I had this one woman come in, and she said to me in fact, she had dentures, and she hated them. She just hated them, made her gag. And she said to me, "Don't tell my husband."
Okay.
Because he doesn't know that I have them. I said, "Really?" She said, "No." I said, "How long have you had them?" She said, 25 years. That's amazing. But I've had that experience with other patients also. They come in, it's amazing. This is part of the experience.
So with her, what'd you do? So she gets a new set of teeth.
What we initially did was we put in implants, and we made her denture so it could snap in.
So it's a cost savings when you use their own denture.
This was a temporary thing.
Okay.
I did this, and then what we did was we gave her fixed permanent teeth. And that's literally like getting your teeth back. It's like literally getting your teeth back. They are beautiful. She didn't realize how they were going to look either. She was all about, they look okay what I have. I just want them to stay put. When we did these, another one, she cried. She cried. But I still don't think she told her husband.
He doesn't know.
And I don't know that he realized it, because sometimes guys can be just, out there. But she was very happy. She was very happy.
Are there a lot of people bothered by their smile?
Oh God. Yeah, there are a lot of people that are bothered. There's a lot of people who don't even acknowledge it, but you know because they're walking around.
You could spot them.
Yeah.
Like as a dentist, you know who's hiding their smile?
Absolutely. They look like they're sad, they look like maybe they're in pain. And sometimes they actually are in pain. Sometimes they just are so afraid to go to the dentist because they have toothaches and they're just afraid to go because they think it's going to hurt too much, it's going to be too expensive. So there could be that it's pain, it could be that they're sad, it could be that they're unhappy, it could be that they just are trying to hide something that they think is really unattractive.
And that changes.
Yeah. Oh.
They start smiling again.
Oh my God, it's like they light up. They just light up.
You're a dentist, so of course you think the smile is like the most important thing, or one of the most important things.
Yes, that's true. But I can tell you because I've had 30 years of watching people go from having no smile or having a bad smile or hiding or talking like this to when they get that smile, how much it changes their life. They don't only change, they change their smile, but then all of a sudden they cut their hair. They start wearing makeup. They tell me about jobs that they got
because of self-confidence.
Because of self-confidence. We know statistically, from research, psychologically, that when somebody else looks at a person who has a really good smile, big smile, that person has a foot up on anybody else who doesn't have that good smile.
Okay.
They are just, we know that that's one of the most important things that people look at. In dating, if you think about dating, Cosmopolitan magazine, I think it's one of the top 3 things. Usually it's number 1, but
like
one
what do
of
you find attracted in someone?
Yeah, what do you find
Smile's always in the top 3.
Smile is always there. So I mean, yeah, I'm a dentist and I see it all. I notice it all the time, but I'm not. This is nature.
People with bad teeth are judged. You know, we talked about this in the green room. That like in Hollywood, in the movies, if you want to make somebody look poor, what do? Give them bad teeth.
Yep. Even though Tom Cruise got away with it for a bunch of years.
What was wrong with his teeth?
Oh, his teeth were very crowded and crooked and all kind of funky, but he had everything else going on, so he did okay. But his teeth, since then, has gotten them fixed. So if you see them now, they look a lot straighter than they did. But you're right. Most of the time, if you want to make somebody look bad, mess their teeth up, make their teeth look.
Even even in the cartoons, you know,
Yep.
I got kids. If you want to make someone look dumb, you remove their front tooth.
Yep.
It's like teeth, like are part of the image.
Yeah, it's true. It's true. And I think this is human nature. It's human nature, and it's not conscious necessarily. It's not something that we really all think about, but it's very real. It's very
You said
real.
people think you look familiar, and you gave me a philosophy. It's because of the way you smile. Tell me about that, or if you could say that again. It's really good. I want to hear it again.
It's not a philosophy as much as a theory.
Okay, it's a theory. Okay.
I can tell you because I don't know for sure. What I think is when I look at people, I smile at them and I really pay attention. I look right into their eyes and I really focus on them. And for many years, people have said to me, "Do I know you? Where do I know you from? Did we go to high school together? Whatever." And I don't think it's, obviously I didn't meet all these people. I think what happens is there's something when you smile at somebody and you look into their eyes that conjures for them on the subconscious, it conjures for them somebody who cares about them, somebody, maybe family.
It's a good point.
Yeah, and I think that this, people don't necessarily, again, this is on the subconscious, but it's very powerful. It's very powerful. And so I think that's what happens. I mean, maybe they saw me on TV, and but I think this idea of just if you really smile at somebody and pay attention to them and focus on them, they'll feel you're caring.
Nice.
And smiling that's a huge piece of relationships.
So, well, then tell me this. I mean, what do they like more? Do they like the appearance of their teeth, or do they like the fact that they could eat and chew again, whatever they want?
Randy, I think it's a combination. I have one patient who, unfortunately, we had to take all of her teeth out, and she got permanent teeth. She sent me pictures of Marilyn Monroe. She sent me pictures of a whole Marilyn Monroe. She sent a few of Marilyn Monroe, actually.
Of the smile she wanted.
Of the smile that she wanted. And it was more than the smile. It was the whole look. It was the feeling.
Okay.
And she came to me really initially because she was concerned about, she wanted to be able to eat. Her teeth hurt. But those pictures, That was really important to her. And she was, when she saw them, she even said, she's like, just like Marilyn. Big smile.
So you were able to make her teeth kind of look like Marilyn Monroe's teeth.
Yeah.
So you designed the teeth? I mean, they look real?
Yeah, absolutely. In fact, it's really, I've been doing cosmetic dentistry for a long time, taking courses with, at LVI and just a bunch of cosmetic programs. And one of the things that we do, which is really, I think, essential when you're doing this, is you show the patient how the different shapes of the teeth can look. And
so they're like picking their smile.
They're kind of picking their smile, because some smiles make them look more youthful or younger. Some of them look more glamorous. Some of them are more stern, or some of them are more masculine. Some of them more feminine. And if you don't let the laboratory, if you don't let them know what you want, you're asking some guy across the country to guess. And that's not the way to do it. The way to do it is to do it as a partnership with the patient and say to them, what do we want? You know, and really it's mostly what do they want? What does the patient want? That's always my goal. I want them, I like to say to people, if I gave you a magic wand and you could just go ding, what would you want? And then just listen.
Now you say that people hold on to their teeth too long.
Yeah.
What does that mean?
They don't have to wait. Look, I had a hip replacement. I was in pain for 9 years. And they always told me, don't do it, you're too young. And I finally did it, and it changed my life. It's the same thing for people's teeth. If you're in pain, if you're unhappy with your smile, if you're hiding, if you're not getting the fullness of life that you can get, go for it.
Do something about it.
Do something about it. Go for it. We can for a reasonable price, we can fix you to your smile and your teeth to make them really just be what you dreamt about. It's a really it's an amazing technology. It's an amazing profession. And
we're out of time. But final message, somebody watching this, and maybe they're still skeptical. They're of the two groups, denture wearer and the person that has failing teeth that they're going to head to dentures. But for whatever reason, they've heard you, maybe saw you on one of your other programs, but for whatever reason, they're still afraid or putting it off. What do you say? What do you say to them?
Give me a call and come in. Let us do a consultation. The reason that I got a CAT scanner is because I didn't want to charge my patients for that anymore. I didn't want them to have to go out. I do a completely free consultation. You can come in and we can find out. I can show you the options. We have payment plans to help you get what you want and get what you need. I'm
good for you.
I'm privileged. I'm privileged to be able to do this for people. I'm very grateful and blessed.
All right. Well, I want to thank you for coming to the show. Good
Thanks.
stuff. They go to your website. They can find out more information. Do you meet everybody on the consults?
Yes.
Okay, good.
It's only me.
All right. Thanks again. Thanks for coming to the program.
Thanks, Randy. It's a pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.